Hi, my name is Hunter and today I'll be going over a focused assessment with a specific assessment. My patient today has severe abdominal pain, so I know I'll be doing a specific assessment on the abdomen. Entering my patient's room, I'm going to complete my 8 pre-procedural steps, and it is important to have my patient give 2 identifiers. So I'll ask them verbally, what is your name and date of birth?
4G-10-21-1995.
Checking their wristband. I see that it aligns, and then I'm gonna put on gloves. So the first thing I'm gonna do is I'm gonna take my pen light here, and I'm gonna just assess the pupils. They are round and responsive to red light, and they accommodate equally. Then I'm going to assess, using my pen light still, I'm gonna assess my patient's mucous membranes. They're pink, moist, and there's no exudate. Now, moving forward, I would like to assess my patient's lungs and heart sounds. So I'm going to do this anteriorly and posteriorly. I'm having my patient sit up straight. First, listening to heart sounds, and then listening to respirations. And then I'm going to do this posteriorly. I'm going to have my patient take some deep breaths for me. Alrighty, there's no crackles or rhonchi or adventitious sounds, and I can tell upon assessment that she has been oriented to the situation, as well as she's not using any accessory muscles and does not look in any distress. Now doing a generalized assessment of her skin. It is the proper temperature. There's no edema present. Her skin trigger returns to baseline, and so does her capillary refill. And then I'm going to have my patient just hold out her arms really quickly, and I'm going to assess her mucoskeletal strength. Wonderful, as well as her legs. Alrighty, and now I will move into my specific assessment on her abdominal cavity. I understand you're in some pain today. Can you explain when it came about, this pain?
Yesterday.
And what kind of pain is it?
Sharp.
Alrighty, and on a scale of 1 to 10, how bad does it hurt?
9.
Alright, and do you have a specific area, or is it more just generalize your whole stomach?
Everywhere.
Alrighty, so first thing I'm going to do here is I'm going to inspect the stomach. There is no hernias, scarring, ecchymosis, but I do see there's a little bit of distension going on. And now I'm going to auscultate her stomach, starting in the right lower quadrant. There's no absence of bowel sounds. And upon auscultating for a full minute, I do hear some hyperactive bowel sounds, which is above 30. So she does have a little bit of hyperactive bowel sounds, which I note. They are, it's a rushing noise, and they are very tympanic. So now moving forward, I am going to palpate, moving in a circle, circulate motions, no walking hands or spirit fingers. I'm going to go from light to deep palpitation unless my patient cannot tolerate it. Alrighty, and I note that my patient's not guarding or anything right now. Wonderful. And then I'm gonna have you sit up, and I'm just gonna assess her kidneys right now. Did you feel any pain or tenderness?
A little.
A little bit. Alrighty. And so now that I've completed my focused assessment and specific assessment on my patient, I'm gonna document my findings, and then I will let my patient know when I'm going to return, and I will complete with my 6 post-procedural steps. And thank you for watching.